talk a little bit about perilymph fistula, which is a fistula in the inner ear, between the inner ear to the middle ear. So it's between the inner ear to the middle ear, let's call it that way. So usually this fistula is specifically, if this is the cochlea, here there is the oval window, and here, or maybe like this is the oval window, and this will be the round window. Now usually this fistula causes rupture of one of these membranes, more commonly the round window, and there the perilymph that is inside the cochlea get out of the fistula to the middle ear, right? This is the area of the middle ear, and this is the cochlea, so this is the area of the inner ear. So something can cause rupture of the oval window or the round window, which are the, let's call it the membranes that separate the middle ear cavity from the inner ear cavity, and this rupture can cause lymph to just get from the inner ear to the middle ear, and this is why it is called perilymph fistula. Now, what are the causes? What can cause this perilymph fistula or perilymphatic fistula? The causes are usually something that will cause the membranes to rupture. For example, barotrauma, where there are changes in pressures, and when, for example, I don't know, the patient changes the ambient pressure and tries, and the Eustachian tube is closed. The patient tries forcefully to open the Eustachian tube, but it doesn't work, so it increases the pressure or change the pressure in the middle ear such that the perilymph membranes, the oval window around window just ruptures. So barotrauma, for example, from diving, can cause, for example, when the patient descends in diving, there may be middle ear barotrauma because it doesn't open his Eustachian tube. The negative pressure can cause the ruptures of the membranes. This is the inner ear barotrauma. Other causes, for example, it's trauma to the head, surgeries. There are surgeries where you touch those membranes and you may cause fistula. Not all the surgeries that are for the oval window, round window will cause this perilymphatic fistula, but some of them can. And there are sometimes causes that are idiopathic, not really known exactly what the cause. Now, what will be the symptoms of the patient, the symptoms and signs? So the symptoms will be hearing loss. Usually the hearing loss is sensory neuron hearing loss because it damages the cochlea. Now the cochlea is the sensory part, and it can cause sensory neuron hearing loss, namely high frequency hearing loss in the air conduction and bone conduction because it's sensory neuron. It can also cause vertigo. Vertigo especially can exacerbate with Valsalva maneuvers, something that cause increased pressure in the inner ear and open the fistula. So patient usually do an exercise, for example, some exercise or some Valsalva or something, and this may cause them to feel the vertigo of this pathology of the perilymphatic fistula. So there is hearing loss, sensory neural hearing loss, because it damages the cochlea, and vestibular symptoms that may happen, for example, vertigo. And the diagnosis is not very easy. The diagnosis is clinical with, for example, what is called fistula test, which is making somehow increased pressure in the middle ear, and this can cause this, and this should cause the symptoms of those burst time of vertigo. So pneumatic otoscopy or Valsalva maneuver, those should be the fistula test, and this Valsalva or exercise or heavy lifting can cause the symptoms of the pathology. Also, the patient should have or will have sensory neural hearing loss, and he may, for example, in diving, may have middle ear burrow trauma because he started with middle ear burrow trauma that complicated with inner ear burrow trauma. Now, the treatment starts with conservative treatment. It starts with conservative usually, lifting the head to, for example, sleeping with 30 degrees of the head like this and not totally flat. Not diving, not heavy lifting, not doing Valsalva or not doing anything that can cause exacerbation, so no Valsalva. And after some days you should see if there is improvement in hearing loss and vertigo. Just a sec. And if it doesn't work, what we are doing is surgery to close this fistula. So this is about perilymphatic fistula.